My name is Dr. Bernard Raxlen. My practice is here in New York City. I'm part of the physician training program of ILADS. It's an evolution, really. I had begun my work in family systems therapy or family systems psychiatry, where the whole was greater than the sum of the parts. That was that you never treated an individual in isolation. You treated the individual in the context of his family. So much of the pathology that you saw was really an issue of communication amongst family members. And from there it evolved into integrative medicine. A long story, but I like to call it, I'd like to call it at that time, drop through the cracks medicine. And the reason was that I was seeing a lot of the patients that were being missed by their my contemporaries. So I was seeing hypoglycemia and blood sugar issues. I was seeing food allergy. I was seeing undiagnosed hypothyroidism. I was seeing candida. I was utilizing orthomolecular psychiatry. And I was using nutrition and supplementation and herbs as part of the armamentarium to treat these patients, all of whom were initially presenting as psychiatric problems, such as anxiety and depression, and bipolar issues, and mood disorders, and ADD type problems, and problems of concentration and focus, and so on. And so as I began to investigate these issues, again keeping in mind the systems issues, I saw a lot of the psychiatric illness melt into a different neurobiological paradigm. With that background, approximately 25 years ago, I encountered several patients that were very puzzling to me, and after much chagrin, I thought, yes, that they may have, and that was the early days of Lyme, that they may actually have Lyme disease. And I knew very little or almost nothing about it. When I couldn't make the diagnosis on the basis of the lab test, I called up my colleague, Dr. Ligner, and sent him the two patients. He called me back and said, well, it's obvious, these two patients have Lyme disease. And I said, well, how is that possible? They have Lyme disease. I did all the testing is negative. It doesn't compute. And he said, you can't trust the testing. You have to be circumspect and deal with the patient and their symptoms. So from that point on, I became interested in the field, and in the Lyme field, especially with Lyme literate medical docs, 1 begets 2 begets 4 begets 8 begets 16, and before you know it, in 6 months your practice is filled with Lyme patients. And so you have the choice. You have the choice to not treat them, send them to another doctor, or you can hunker down and begin to see these folks. They're a fascinating group of people with multiple systems and multiple systems involved. It really brings your medical knowledge to its razor sharp keenness, if you will, and you can help people that are in desperate need at times. One of the patients that stands out in my mind is a young woman in her 30s who was an Ivy League graduate and high-end athlete that had been felled by this illness and had been in bed for a period of almost 3.5 years. She could only get up to go to the bathroom. She'd gained about 70 pounds, so she was 180 or so from her 125 pound weight. And the first time I saw her, she was in a wheelchair pushed by her mother. She'd been to approximately 18 physicians throughout the Boston and New Haven and New Hampshire area. But she had an incredible spirit, and in the first visit she said, "Doctor, I know you're going to help me, and I'm going to walk into your office dancing." Well, it's 2.5 years later, and about 3 months ago that very scenario happened, and it was really a heartfelt encounter. Another one, just quickly, that stands out was a lawyer who had a walker when she came in to see me. She was an estate lawyer in Long Island, and she was used to dealing with high-end mathematics figures, you know, estates and transfer monies and contracts and the whole thing. And her neurocognitive abilities were so diminished that on her second visit she brought in a grade 1 math book, and she was trying to learn all over again the fundamentals of the mathematics that we learn in first grade or second grade. She could subtract, like 2 from 4 or 3 from 6. She couldn't get higher than 8. She couldn't multiply, she couldn't divide, and she could read probably at a grade 4 level. This is a woman who was tops in her field in estate law, and she couldn't figure out a grade 1 math book. I'm happy to say that 2 years or so of treatment, including some aggressive intravenous work, most of them, those patients that were so ill had it do intravenous. She came in walking, no walker. Her math skills were back to their top form, and she was back in practice. Some of the challenges that we're facing in treating tick-borne disease, well, first of all, is the disease itself, its many manifestations, and its difficulty in determining often a correct treatment protocol, because the treatment protocol changes with the dynamic of the patient's healing or lack of healing. So that in itself, just the disease. Of course, their medicine at this point in time is pretty much stonewalling the illness. We have no good diagnostic markers even now, which could end the controversy. You've got insurance being very reluctant to fund a long-term treatment, which many of these people need. You have the major medical journals blocking articles that have been written by other authorities who disagree with the conventional IDS stand. You have state organizations that are compelling physicians to go before the board and in essence harassing them. Many of us have been harassed. I've gone before the board 4 or 5 times and spent close to $100,000 defending myself, and on no occasion have I ever been cited for clinical misconduct on each of those occasions. You know, it's kind of like a DNA transfer. I mean, that's how medical knowledge moves forward, by an aggressive teaching and training program. We were taught by our elders, and they were on the shoulders of giants, and so that same transmission of information, if you're a doctor, is part of your Hippocratic oath. And so I just feel it my responsibility to transfer the information that I know to a colleague that's interested in treating the disease. Well, again, it's the same idea that you are taking your knowledge, you're transmitting it to another medical professional, and they in turn can carry that into their own medical environment and help patients, which is why hopefully we all went to medical school. And the significance of the training program is that without the training program, because the literature is closed at this point in time at least to some of the important clinical findings and clinical treatment protocols that is necessary, and the degree of almost epidemic proportions that the disease manifests itself as, we need more doctors that can really see the problem and move forward in a way that will ultimately transform the field and patients' lives. You can get more information regarding this teaching program by accessing ilads.org.